I am your host, Nicole Will, and we're so happy you're here as we navigate the world with your aging loved one. We are here to come alongside older adults, family members, and the senior living community as we explore the world of aging and elder care with helpful resources, informative interviews, and approachable conversation. We get to do this together, so join us on our journey, and this is the Will Gather podcast. It's so important that we have a place to go as families, personal and professional caregivers, where we can learn about dementia care and how to interact and provide valuable support for our loved ones, and a place where we can have the tools to feel equipped to provide the best care possible. I have learned so much from my guest today, and I know you will too. I'm so lucky to have Adria Thompson in my life. She is a licensed speech language pathologist with over 9 years of experience in dementia care. Adria holds a master's and bachelor's degree in communication disorders. She is the owner of Be Light Care Consulting, and through her consulting business, she creates educational content for caregivers on social media platforms. She offers one-on-one caregiver consultations. She develops continuing education courses and collaborates with senior care companies and brands to promote their services and give us all of the great information that we need. Her passion is really increasing the awareness of dementia care. This has made her a sought-after speaker presenting at conferences and events across the country. Today, we are talking about the world of speech therapy, its crucial role in dementia care. What are some of those challenges that individuals with dementia face in both speaking and comprehension? Adria shares her expertise on strategies that can help us maintain communication and swallowing abilities, addressing common misconceptions about dementia behaviors, and discover the reasons behind certain things like resisting to shower. She guides us through those environmental modifications that can make showering experience more enjoyable and less overwhelming. She sheds light on successful communication techniques that can assist us as caregivers in navigating this process with our loved one. Join us as she encourages us, and we find the immense value of speech therapy and dementia care. As we learn about the process of finding and receiving speech therapy, we're going to gain a deeper understanding of how these professionals can make such a positive impact in the lives of those living with dementia. And finally, we will explore those resources at the end, but also Adria has an exciting announcement. She gives us a sneak peek into her upcoming course, which you do not want to miss. Here is my interview with Adria Thompson. Hi, Adria. We get to be together. We get to talk. It's been a long time coming. I've been just so grateful for your work and how you reach families and older adults. And now we get to have you share here. So thank you so much for being here.
Thank you, Nicole, for having me. I'm really excited to talk to you today.
Well, we're going to talk about a couple topics, but I do feel like they're all really interconnected. And I would love for you to tell us who you are, what you're doing, and then that's going to tie into the first thing we're talking about, which is what is a speech language pathologist and how does that support those that we love that have dementia and older adults in our life.
Yeah, my name's Adria Thompson. I've been a speech language pathologist for the last 9 years, working mostly in long-term care, so in nursing homes, assisted living communities, and memory care communities. As a speech therapist, a speech language pathologist and a speech therapist are the same thing. So that's a question I hear a lot is what's the difference? There's not. It's the same thing. So as a speech therapist, I help individuals in three main areas, which is communication, swallowing, and cognition. So communication, a lot of times we think about talking, right? A speech therapist is producing speech, and that absolutely is part of what we do. But more than that, we help with comprehension as well. So speech would be a component of expressive language. Writing is also expressive. But comprehension is a big component of communication. So understanding what other people are saying, and then reading is also a component of comprehension. And then we help with swallowing. So any deficit in swallowing is called dysphagia. So that is the condition where you have a swallowing disorder. That can be a problem anywhere from where food or drink enters in between your lips, all the way to where it empties into your stomach.
Mm.
So that can sometimes, especially for individuals with dementia, look like difficulty with chewing. They might pocket food, which means it kind of gets in their cheeks. They might cough or get choked, or what we might describe as things going down the wrong way.
Mm.
So we can assess, diagnose, and treat in all areas of swallowing. And then cognition is a big umbrella term, which is just thinking skills. So memory is what we think about when we think about dementia. It's people having trouble with their memory, but there's much more to cognition than that. There's reasoning, problem solving, safety awareness, attention. And so we can assess, diagnose, and treat in those areas as well.
So helpful. I did not even think of comprehension as being a component. You're right. We think of speech and we think of the expressive, not necessarily how we interpret that. So
Yeah.
it's so fascinating.
Yeah, and it's extremely important to acknowledge that not only people with dementia have difficulty speaking and
Mhm.
expressing themselves, but they have difficulty understanding the speech and expression of others. So that is where a lot of speech therapists, like we would do a lot of education, teaching people to slow down, to put pauses, and allow people that time to process.
Which has to take practice on our end as that care partner because we want to move forward and keep things happening at a pace that acknowledging those tools that we have to implement to just slow down and take our time and learn from people like you that have that expertise.
And it can be extremely difficult, especially when someone has problems hearing. So when we say something or ask a question to someone with dementia, hearing loss is very common as you get older. And so we might think, oh, they didn't hear us, when really they heard, but they just didn't understand. So that results in people speaking really loud when that's unnecessary. And also, we think we have to repeat ourselves incessantly. What do you want to eat? What do you want to eat? Do you want to eat? Are you hungry? Are you hungry? What do you want? If we thinking that we just need to, oh, say it again or say it differently so that they can hear us better, when really the issue is comprehension and that repetition. I'm snapping my fingers here, but every time we say it again, we start a clock over and they have a new thing to process. And so we're making the whole task more difficult.
As families, when we're with our loved one, what should we be thinking about or understanding in terms of when do we know that our loved one could use the support of a speech therapist and how can they benefit from working with a speech therapist, our loved ones with dementia?
I want to answer that question by first delineating two different things. So, in the world of therapy, whether it's physical, occupational, or speech therapy, we most often think about rehabilitation. So, the idea that we are going to take someone who has a certain level of abilities, then they have an illness, injury, or a condition. And then on the other side of that, they have deficits. And so the concept of rehabilitation is to kind of reach behind that illness, injury, or condition and restore the abilities that they once had to make them as good or better than they were before. And, I run 3 miles, my leg is broken, I have rehabilitation, and then I can run 3 miles again. That is what we think about. And so when caregivers think about therapy, they're like, well, but my dad has dementia, but my wife has dementia. Like they're not going to get any better. So what's the point? And when you think about it with that model of rehabbing, then I totally understand that. I can see how you might be perceived that therapy is not going to be beneficial. But there's not just a rehabilitation model in therapy. There's a habilitation model. Habilitation is used for conditions that are degenerative or progressive in nature. And so what that looks like is that we're not restoring skills that are lost, but we are maintaining skills that they have. So there's an illness, injury, or condition. And after that, yes, there are deficits. But what we want to do is maximize and maintain where they are right now so that they can stay as independent, as safe, and have as much quality of life as possible. And when we're dealing with degenerative diseases, of course, long term, they're going to get worse. But if we can implement therapy during that time, then we can train caregivers to kind of keep those skills longer than maybe without. So, to answer the question, yes, when might someone think that speech therapy could be beneficial? Is in some capacity, if you have a loved one with dementia, if they have difficulty with cognition, communication, or swallowing at all, then they could benefit from a speech therapist. That speech therapist isn't going to cure them, it will not make them 100% better, but they can give you some insight, some training, and exercise some of the skills that your loved one has to keep them as functional for as long as possible.
And to keep that dynamic. Do you find that there are common strategies as a speech therapist that can maintain that communication and the swallowing? Speak to what your expertise is and how does that really work logistically?
Yeah. So, of course, it will be individualized to what each person needs and what their deficits are, what type of dementia they have, how progressed they are, what stage of dementia they're in. We will consider all of those things. But to give a practical example of what it might look like to keep communication more functional for longer, might be for someone who has the primary progressive aphasia subtype of frontotemporal dementia. So this means that individuals with this kind of dementia will have difficulty with language as their very first symptom of dementia. And so they will have difficulty word finding. They will have a hard time thinking of the words they want to say. They might know what they want to say and they can't say it. So in that example, what I often implement is creating some kind of pocket vocabulary, is what we call it. So something they can literally keep in their pocket, a journal of some kind that has common words or phrases or things that they forget frequently. This might be things like they love to go to Texas Roadhouse to dinner. That's their favorite place to go. And they want to be able to order rolls with cinnamon butter, extra cinnamon butter, please, and salmon with a sweet potato. And so that might be what's in their journal to keep up the repetition and to provide a form of cueing for them that they can independently use. So that would be an example for communication. And as far as swallowing goes, there are many reasons that someone might have swallowing disorders. Dementia is not the only one. There are many other conditions that can result in that. So there are exercises that can be done physically, like chin tuck against resistance is an example, where you take a small rubber or plastic ball or even a rolled up towel and you can put under their chin and they can push down and that strengthens physically. It's an exercise we can do to strengthen the muscles of the neck and throat. That's not an exercise that's appropriate for every person and every reason for swallowing deficits, but that would be an example of a way that we can help maintain their strength.
Yeah, the ability. There are so many components when working with our loved ones that have dementia, and some of those challenges, and I hear families talk about it, and I'm sure you do too, is that there's this commonly referred to term called the behavior. And
Mhm.
and why is it important to understand them? Do we have a better word for that? What is your preference when you speak to that? And yeah, a lot goes
Yeah.
into that. And we'll kind of talk about more of those specifics, but that
Yeah.
overarching term.
Yeah, when it comes to dementia, there is definitely a conversation that's worth having about the language that we use
Mhm.
and the semantics of how we describe how someone is interacting with their environment. And personally, I don't always dive so deeply or correct caregivers when they use terminology that might not be favorable or as dignified as we can possibly be. So the conversation that I'm referring to is saying that someone is demonstrating a behavior has a negative connotation. It's like a temper tantrum or something. Like it
Right.
has that same kind of feeling when we talk about a dementia behavior. And so there's other words we can use. People say a behavioral expression, an unmet need
Hmm.
expressed physically, right?
Yeah.
There's all these things we can call it. And I don't know that anyone has landed on the perfect
Yeah.
terminology, but we all know what we're talking about.
Right.
We know that we're talking about when someone with dementia behaves in a way that is seemingly illogical, unreasonable, exaggerated from
Hmm.
the experience that they're having. And typically it's negative. And when we talk about it, right? But right now, I could say Nicole is having a behavior. And although listeners can't see that, you might think that she's like raising her fists at me or
Hmm.
flipping me off, but no, she's nodding her head and smiling.
Yeah.
Like, but that's a behavior.
Right.
That is
Right.
just a way that she is expressing what she's experiencing. She's listening, she's like being a good listener and she's engaged in what we're talking about.
Mhm.
So ultimately, behaviors are neutral. But when we talk about it for someone with dementia, often there's that negative connotation.
Yeah, there is, which is why I also struggle with that word. I don't know if we have a better one, and I feel like people say it and then we go to the negative, right? Or we
Hmm.
something that we have to address, and it often means that something else is happening, right? And
Hmm.
there's underlying causes and things that contribute to that. What are some of those common reasons for those underlying causes, and what do we get wrong about it? What are some of our misconceptions when we're working with people that might be expressing that?
Yeah. As caregivers, whether we're professional, like working in a long-term care setting or a nurse or a doctor, or we're a personal caregiver, when we see someone with dementia exhibiting behaviors, we're just going to use that word.
Yeah,
That's
we
just
just
what we're
got
going
to
to
use
say.
it.
Yeah. For simplicity,
Yeah.
okay? We will come to it with a belief, a bias, right? Like we said, a lot of times it's negative. But we have to understand in that moment that let's give an example. Let's say we want someone to shower, okay?
Hmm.
And we can talk more about this
Hmm.
in a minute, but just that example in general, I want my mom to shower. And I have all of these thoughts and understanding and reasonings why I want her to. Well, it's been 3 weeks since she has. She is looking disheveled and everyone's noticing. She smells. She is incontinent. And so, therefore, like, I'm concerned about her skin and the cleanliness of it and maybe an infection. And all of these things are completely understandable and they're legitimate in my reality, which is the reality that matters
Yeah.
to us, right?
Yeah.
And so when my mom says, no, I already have, and she hasn't, I have to acknowledge the fact that she is coming to this experience and this conversation with her own beliefs and reality. So in her reality, she showered this morning and she has no awareness of how she looks, nor does she care because she's experiencing apathy, which is another symptom of dementia. She needs to get out of here because she has to go to work, in her world. And so there's all these reasons why we're going to have some friction in that moment because I come with an agenda and so does she. She is not cognitively able to understand mine, and I am maybe not empathetically able to understand hers. And so that's where the friction comes, and that's where we see behaviors. But I am a firm believer in this phrase, and I like literally will chant it to myself sometimes when I'm working with clients, but everything they do makes sense to them. I will tell myself that all the time when I am seeing something that they're doing that seems so unreasonable and so illogical. I'm like, everything they do makes sense to them. So, in what world and in what situation would I behave the same way? And it's when we start having thoughts like that that we can find some breakthroughs.
Oh my goodness. I love that sentence you just said. It really gives us that compassion. It
Hmm.
does, which is that's the lens that we need when we're working with our loved ones because we might not understand it, but we know that it makes sense to them. Yeah.
Yeah, and I would love to give two examples that I just think are perfect for this. These are two individuals who are patients of mine in memory care. And so one is that there was this lady, we'll call her Mary, and staff was telling me she will not sit on the toilet. She resists. She will say she needs to go, and then we get there and she will not. She's like a brick wall. We cannot get her to bend and sit on the toilet. And so I'm like, that's odd. What a strange behavior, right? Like
Yeah.
that's my first thought.
Right.
What in the world? So I take her myself, and it took me 3 or 4 times before I realized that I had this moment where I was walking her towards the toilet. She was willing to go. And I also know, especially as a speech therapist, I could assess the fact that she can't express her wants and needs very clearly verbally. She has a very limited amount of words that she can use, and she was not able to express in that moment verbally why she wouldn't sit. We couldn't just say, Mary, what's going on? Why aren't you sitting? But instead, when we were walking towards the toilet, she said, ugh. And I just had this epiphany, and I thought, what is a reason why I would not want to sit on a toilet seat? And if it's disgusting, right?
If it's
If you're at a
gross.
porta potty, yeah, you're at a public place, you go to a concert, you open up a stall and you're like, ick, right? Like, no.
Yeah.
And so and so I will not sit on a toilet seat if it's disgusting,
Oh,
right?
totally. I'll
And
like,
so
hover.
hover. Yeah.
Right.
Sure. And so I just was like, okay. I said, oh, hold on, Mary. I put on a glove, I got a wet wipe, and I cleaned the toilet seat. And I said, okay, it's clean. Go ahead and sit. And she immediately sat. And I was like, of course. The thing, and I told her daughter this, like what I kind of figured out. And she said, well, she never did that at home. And I'm like, well, I don't do that at home either.
No, yeah.
Like, even if it's not like the cleanest toilet, I'm like, I
Right.
know it's me. So,
Exactly.
like, I just need to clean it.
It's
But
not
of course,
stranger
yeah,
germs. Yeah.
right. You sit on the toilet seat. And so just having that insight, because she was new to the facility, and although that bathroom was hers and it was adjacent to her room and no one else was using it, to her it was a public restroom. And she likely was a hoverer in
Totally.
public.
Yeah. Oh my goodness.
Yeah.
What a great
So
example of that.
that's a great example. And then the other is much more simple, but I had a man, we'll call him William, and he kept standing up one day during lunch. And he had his food in front of him and he kept standing. And I was like, sit down, William, sit down, sit down, sit down. You need to eat, you do all those things. And he was just so anxious. And I decided everything he does makes sense to him. Like, what's going on? And I observed his body language and I noticed that he was just like rolling something in between his fingers, and he had his fingers kind of clenched. And I said, what do you have in your hand? And he opened it, and it was some like pocket fuzz. And so I grabbed a trash can and I brought it over, and he dropped that little piece of fuzz in the trash can, and he went back to eating. He wanted to stand up to throw this thing away that he found in his pocket. And although illogical to me, that was important to him. And so once he was able to get that need met, then he could focus on the food. He wanted to eat too. We often think that like these things that we want someone to do, when they give us some friction, that they just don't want to do it. But that's not always the case.
That's a really good reminder. It's such a good reminder of that. And you mentioned the showering example, and that is something families speak to all the time, which is like, okay, I can't get my loved one to shower. They don't want to go in the shower. It's a common challenge. Why is that the case? Why is that such a big hurdle? And what are some of those common reasons behind that particular resistance?
Showering is a very complex task that we take for granted. And it's not until we experience some level of physical trauma, maybe we have a surgery or childbirth or something, and you realize how physically challenging a shower can be. It's also very cognitively challenging. How many times have you been in the shower and thought, wait, did I shampoo already? Like, you get like in this groove, and you realize that it takes more thought than you have put into it. And it takes a lot of energy. It's very tiring, although it can be relaxing. It can be very tiring too. And so we need to acknowledge the fact that showering, although in theory is pleasant, there's a lot of steps that go into it that can be hard. And so when someone will message me or will just ask me, I can't get my mom to shower, what advice do you have? My question back to them always is, why won't she shower? And seems simple, but oftentimes we don't ask. Like, we don't ask people with dementia. We say it's time to shower, and they say no. And we're like, no, you have to. And we start getting into this cycle of explaining and reasoning and convincing them that we don't take a minute to say, well, why? Sometimes they tell us straight out.
Yeah.
But sometimes we don't ask. So the way that we're going to intervene, the way that we are going to create an intervention, which is basically a therapy term for like the change we're going to make to hopefully have a better outcome, is by acknowledging and specifically addressing the objections that they have. So too often, sure, getting the shower room, the bathroom warm, playing music, all of those things are nice and lovely. But if their objection is that they've already showered, then that's not addressing their need. If they said, I'm cold and we make it warm, then absolutely that's going to be a good intervention. But if they believe that they've already showered, then we need to address the fact that what would we do if we've already showered and someone asked us to shower again?
Be
I'd say
like,
no.
no. Yeah.
I already dried my hair. I put on my makeup. That sounds like too much work. So we need to address the specific objection that they have. If they say, I've already showered, then I always think about what would it be a scenario in which I would shower again if I'd already showered.
Mm,
There's not many because I don't like to redo my hair, makeup, put on clothes, and it takes time out of your day, right?
yeah.
But some things that I thought of that I implemented with some of my patients, to give you some examples, is a spa day. If I got in the mail or someone knocked on my door like they do with like Publishers Clearinghouse and they're like
Mhm.
standing there clapping and they say, Congratulations, Adria, you just won a spa day. You get a full makeover right now. Go downtown to the local salon and they will do you up head to toe. I would be like, heck yeah, let's wash my
100%.
hair again. I know I just got out of the shower, but let's do it. And so I actually will make certificates when I was working in long-term care, and we would put on this show of drawing a name for someone to get a spa treatment, and we would pull out, Mary's name, and we would say, "Yes, congratulations, Mary, you won the spa day. It's got to be redeemed today, though. We got to do it now." But that's so exciting and providing them motivation
Yeah, that's a
to
great idea.
participate. Yeah, it makes all the difference. One more example was inspired by my husband because the only time that he will shower more than once a day is when he gets a haircut. So he'll shower, he'll go get his haircut, and then even if they cover him with a drape and they do all the things, those little bits of hair on his skin drives him crazy, and so he'll shower again.
Yeah.
And so I had a man who was going a long time without showering during COVID, and we were all playing hairdresser. I mean, it got to the point, months that hairdressers couldn't come into the building, and we were
Yeah.
just trying to keep people's appearance up as much as possible. So I had the idea. I know this is how my husband feels. So I sat this man down, purposefully did not put a drape over him. I trimmed his beard. We trimmed his hair. And then I said, Oh no, Bob, I am so sorry. Look at this. Oh man, there's little hairs all over you on your clothes, on your skin. I completely forgot to cover your clothes. I'm so sorry. Here, let's jump in the shower real quick. I'll rinse you off. I apologize. And oh, honey, it's okay. And he got
Oh,
right in.
wow.
And
Wow.
so thinking about like I said,
Mhm.
everything they do makes sense to them.
Yeah.
Whatever objection they have, we need to think, okay, if that were true for me, and also combining with the information we know about them,
Right.
then what situation would have to be facilitated in which they would participate more willingly?
That's such a great framework to have. And with those strategies, right? Because it is so individual, knowing the person and what would work and what they've done before. Are there any environmental modifications or ways we can adapt the environment that lend itself towards that shower experience to be more comfortable or less overwhelming?
Certainly, especially for individuals in the moderate and later stages of dementia, they get distracted really easily. So, when I was working in memory care, that was true for majority of our patients.
Mhm.
So, we would completely clear out the bathroom. So, we would take everything off the counters, toothbrush, washcloths, we put it all underneath the cabinet, close things up because out of sight, out of mind is very much true for people with the later stages of dementia. And so when we came into the bathroom, there wasn't 700 things sitting around to distract them. What was going to happen in the shower was the most interesting thing. And that's what we want. Too often, I would come in and then they would see something and they would they'd pick up a washcloth and they would have to perfectly fold it, every corner perfectly crisp, perfectly.
Mm,
And so if we know that someone has those tendencies to being distracted, to fidgeting, to messing with things in their environment, then we need to prevent that from ever being an issue. So clearing things out of the bathroom I also usually recommend clearing out any other sitting surface.
Mm.
I love transfer benches, which are the kind of bench that extends outside of the bathtub or the shower, because it is a non-confrontational way to get someone near the shower. So if we have decorative little chairs or benches sitting around in the bathroom, they're going to want to sit down,
Mhm.
and we don't want to give them the option to sit on a little fancy chair in this on the corner,
Right.
right?
Yeah.
We want them to eventually be in the shower, so let's sit on the transfer bench where they can still have their feet outside of the tub.
Mhm.
And then once they feel comfortable there, this place and this situation doesn't feel scary to them, then we can slowly move them over into the shower a little bit easier. So implementing, clearing things out, but then also having some pieces of equipment
Mm.
that can make the transition into the shower safer
Right.
and easier is super helpful.
Oh, I
And
could
then,
see that.
yeah, like I said too, also like music and warmth is also things that can make it a more inviting place to be.
I even feel that way, right?
Hmm.
If it's not super cold. And in terms of communication, are there general ways that we can approach how we communicate that? And I know it's individualized, but
Hmm.
how have you seen success in the words that we use or what we say?
It's often timing that's as important as what we say. So, too often, I would see staff members come up to someone, whether they're in bed, comfortable, or they're sitting on the couch with their friends, and they say, "It's time to take a shower," or the dreaded, "Do you want to take a shower?" giving them the opportunity to say no. But even if we say it's time to take a shower, this is not the time or place, right? Like if I was hanging out with my friends at a restaurant and someone
Yeah.
came up to me and was like, "Let's go shower," and I wasn't aware of the fact that I have an apartment 2 feet from where I'm
Right.
sitting, it's like, "Oh, this is so inappropriate and embarrassing. Like,
That's
ma'am,
so
please get away
true.
from me."
Yeah.
But what we can do is instead say, "Hey, I need your help with something," or "Hey, I want to show you something.
Mm.
Hey, I need your advice on something. Can you help me? Come with me." I always wait until I'm inside the bathroom with someone before I ever bring up the topic of showering or bathing. So get them in the bathroom for some other reason, and we can use what we know about them to figure out what that might be. Maybe we want them to smell a really new perfume that we got. Or maybe for a man, we might say, "The faucet keeps leaking and I don't know how to get it to stop. Can you help
Mm.
me? I don't
Yeah.
know what I'm doing."
Right.
And so it might just be like turning off the knob,
Yeah.
but having some reason for them to come into the bathroom first, get them in there, make them realize it's not a scary place, close the door.
Hmm.
Closing the door will then decrease out of sight, out of mind again, decrease distractions that could potentially get them to want to leave the bathroom that's out in the hallway or out in their bedroom, for example. So those things are important. So timing of
Mm.
when we bring it up is essential. We need to get them in the bathroom first, and then we can bring up the idea, the semantics of whether we say, "Let's shower, let's take a bath, let's get washed up, let's get cleaned up." All of those things might have a different outcome for each individual. So play around with what words we use. And then another phrase that I find helps a lot is, "You were telling me." So I might say, "You were telling me earlier that you couldn't get anything done with your hair. You know what? I have some time. I would love to do your hair. Let's wash it. I will dry it. We'll curl it. We can roll it, whatever it might be." Or, "You were telling me earlier that your back was itching. Let's clean it off really well and put on some of this lotion that your daughter brought. I think it'll feel so much better." So the idea of "you were telling me" kind of puts the ball in their court as though maybe this was their idea.
That makes so much sense, especially about the timing. I've witnessed that where we're in a great room, an activity room, and someone comes in and is like, "Time to go take a shower." And when you look at it from their perspective, absolutely, that would feel so awkward and not the right time at all.
Hmm.
Yeah.
Yeah.
Wow. I'm not going to forget that. That's really insightful. And let's say, okay, that still is a really, really big challenge. Are there alternative methods or products that you've helped people consider when maybe the traditional shower is not working quite so well?
I think the first thing we should do when we find that the bathroom and the shower is becoming a place of a lot of anxiety,
Mhm.
or there's a lot of fighting that's happening in the bathroom, is the first thing we need to do is try to make the bathroom a less scary place. So sometimes when people have so much trauma that happens in the bathroom that they just have this pattern of resisting and caregivers not finding those creative solutions that help them, then I'll just say, like, bring them into the bathroom just to, like, listen to music or paint their nails, like, have some pleasant experiences in the
Mhm.
bathroom without pushing showering for, like, a week, and just desensitize them to the environment of the bathroom.
Yeah.
And often the transition I will do is have them sit on the transfer bench fully clothed. I will take off their shoes and socks and say, "Hey, I'm gonna check your toenails. I'm gonna clean your feet." And so we start getting it warm. We wash their feet. We move up their legs a little bit. We push their pants up as we go. We're cleaning their legs. And at a certain point, I don't know what happens to me. I just get so messy and water is like getting on their pants. Of course, this
Mhm.
is purposefully, but I will purposefully kind of get their pants a little wet and I'll be like, get the floor wet. And I'm like, oh my gosh, I'm so sorry. Hey, let's put your feet inside of the tub so I don't make such a mess. I am so silly. And so we get their feet in the tub and then we do some more. We wash their hands and we get them to feel like, hey, this is really kind of nice.
Yeah.
Every time they start to resist or they say, hey, stop, or whatever it is, I stop. I am so sorry. I upset you. You know what? I'm not going to do that again. I'm so sorry. Change the subject to something they like and then keep trying again. I have personally never been in a situation where I couldn't shower someone.
Mm.
It just will sometimes take 3 hours, and
Yeah.
not everyone has that kind of time, but we can. At a certain point, we can say, you know what? Let's just take your pants off and let's just like wash up real well
Mhm.
now that it's warm and everything. And I always tell caregivers too, it's okay to start a shower if someone is half dressed. If they still have a brief on, if they still have
Mhm.
their shirt on, using a handheld shower head, we can clean specific areas,
Yeah.
accidentally get their shirt wet, then
Right.
remove that. But I've completed an entire shower with someone having their incontinence products on
Mhm.
because they were very modest, they didn't want to, and that's fine with me. I can do that because at the end, it's gonna fill up with water so much that when they stand to get out, it's gonna fall off.
Right.
And it's at that point that we can rinse, wash, rinse, and then get them out of the shower. But to answer your question, if that becomes physically difficult or we cannot find the solutions to get them to shower, then there are a lot of cool products that
Mhm.
are exist out there. There are some inflatable bins that you can like lay your head back in even while they're in the bed to wash someone's hair.
Mhm.
There are baby wipe type of wipes that are huge that can cover a lot of area to
Yeah.
do a bed bath or what we might call a bird bath at the sink, just cleaning
Mhm.
strategic areas,
Mhm.
prioritize certain areas. So there are a lot of things that exist out there that can really be helpful to get people clean
Yeah.
as possible if we can't fully get them wet. And my favorite is a shower cap, a rinseless shampoo shower cap. You can buy these at many of your just like local pharmacy area
Mhm.
places, but certainly on Amazon or something like that. But you put it in the microwave for a few seconds and then you kind of like it's a shower cap out
Mm.
on the outside, but you kind of smush it together and then you put it on their head and you move their hair around and it's a rinseless shampoo. So it cleans their hair, but you don't have to rinse it and it's all in shower cap form. So that's a really great way, especially if it's just like a after a surgery or something
Yeah.
like that, a short-term fix.
Right. Need an idea. Oh, thank you for sharing about that. And there's so much, I think, that as families, we're learning how to understand what our loved one is going through and having that empathy. And how would you encourage families to, the term that you had mentioned about it makes sense to them? Are there other things that you can encourage them in when they're with their loved one and trying to navigate all of that?
Yeah, I always just encourage people to know that you're going to make mistakes, but to instead of getting so frustrated and down on yourself or frustrated with the person with dementia, to know that that is helpful to us. I am a therapist and I take data on my patients of, they were successful 80% of the time or
Mm.
whatever it might be. And I always say if I took data on myself as therapist and the kind of care I provided on a good day, I would be 20% effective
Right.
because there's so many things that I try that don't work.
Mm,
But that doesn't matter because eventually you can find the one thing that does,
mm,
and that is life changing. It's quality of life changing.
right,
And
right.
so when you try something, you have a brilliant idea. Maybe you watch one of my videos on Instagram or something and you think, oh, that would be perfect for dad. I'm going to try that tonight. And then you do it and it doesn't work. It is not a reflection on you. It is not a reflection on them. It just didn't work. And that's okay. It can be neutral and we can just try something else. So keep moving forward, keep trying something new, and never believe that you've tried everything.
Mm,
That is so impossible. And I know it
mhm.
feels that way and it can feel so hard. I tend to want to believe that there's more things out there
Right.
that can give you hope, you know?
To be creative. And there's resources that are out there, and you are one huge support and resource for families. So I can't wait for you to tell us in all the ways that you support people. But also, do you have other resources that you like to direct people to as a source of like hope and inspiration as they're walking through this?
Yeah, so if your loved one has a specific type of dementia, I really recommend getting involved in the associations that are reflective of that.
Hmm.
So, like Alzheimer's, of course, has the Alzheimer's Association. Frontotemporal dementia has the AFTD, the Association for Frontotemporal Disorders. And Lewy body dementia, they have their own association. I think it's important to be around, connect with, and look at the resources that the specific associations provide because those are going to be the most relevant to you in your
Hmm.
walk. But there are some amazing people on Instagram, which is so strange that we are going to social media for medical advice and tips and education
Hmm.
sometimes, but it's the truth. That's where it happens.
Yeah.
So, of course, my page is Be Light Care, and I'm on Instagram, Facebook, and TikTok. I am coming out with some courses here in the next few months. Actually, I have my first course is how to shower someone with dementia.
So
So it
beautiful.
is hours long of information that is like you can just pick and choose what's helpful to you. I determine 11 reasons why people with dementia don't shower. I give you red flags to indicate if that is the objection that your loved one is experiencing, even nonverbal things you might notice, and then interventions that you can implement for each of those. Lots of product reviews and things like that too. So it's interesting. We talked about
I
that
know.
today.
It's perfect. It's like
Um,
we're segueing and then people
yeah.
can go really learn a lot more because there's so much to
Yeah.
it. Yeah.
Yeah, that will be coming out in the probably this summer. We'll just say the summer of
Hmm.
2023. So just follow along on my Instagram. My website is belightcare.com. I will have information on all of those when that course is available.
And you address so many different things. So give us some examples of the things that you talk about on your Instagram. I always learn something new when I watch one of your videos.
Yeah, on my Instagram, I just provide some really practical, easily digestible tips. So, how to get someone to shower, of course, that's on there. Toileting, how to get them to change clothes, how to get them to just do what you need them to do in general, communication
Mhm.
techniques. I also have lots of educational videos about does your loved one, are they lazy? Are they in denial?
Mm.
And I explain the neurological symptoms behind that, what's going on in their brain that can make it appear that way. And yeah, I have a lot of awesome connections with caregivers. We'll do Instagram lives with caregivers of different individuals with dementia and different types of dementia.
Mm.
So there's always something new. I do product reviews. There's a lot of awesome products that I've been able to connect with companies in the last year to share some really, once again, quality of life changing products
Right.
that can make caregiving easier.
It's so needed and supported. And you're right, we do go to information now. I know I do. As Instagram, I decide where I want to go out to eat, where I want to
Hmm.
travel when I'm learning. It's such a great place for information. So, and I feel like it helps to have the visual as well as the audio and putting it together and being able to see practically how things come together for sure.
Yeah.
And in understanding, as a speech therapist, I think we go to, okay, the speech side, but there's so much more that we can benefit from, and the creative ways that speech therapists can work with older adults and loved ones. What are some of those if families are wouldn't think of, maybe like that's super practical and helpful?
So we can do voice therapy for individuals with Parkinson's disease. There's a certification I was just telling a caregiver during a consultation today called the Lee Silverman Voice Treatment. It's specifically created for individuals with Parkinson's disease to help them be more articulate and be louder in their speech. We can do assessments and training in diet modifications. So if someone is experiencing a difficulty with swallowing, we are the ones that tell you how soft food needs to be. Maybe we need to thicken liquids. It's really important that you always speak with a speech therapist before making any kind of modifications like that. Yeah, we could do, like I said, compensatory strategies for creating external things in the environment that can help people remember things, and just engage with their environment in different ways. There's some techniques called spaced retrieval training that speech and occupational therapists can do that is an evidence-based way to actually get someone with memory loss to remember something. So there's a lot of really cool benefits to speech therapy. And if you are interested in having a speech therapist interact, assess, or treat someone that you love with dementia, the first place, at least in the United States, that you need to go is your primary care physician. Ask for a referral for a speech therapist in your area based on the needs of the person who's receiving care. They might be able to come to your home through home health therapy. There's also outpatient clinics, and they also exist in long-term care communities, nursing homes, assisted livings, in the hospital. We're everywhere.
Yeah. Oh, that's so good. And that was my next question, is
hmm
how do we actually make this happen? And the
hmm
collaboration with the healthcare. I think that's really evident as you're working with all the different healthcare departments and coming together just to support that health. So I can't thank you enough for the thousands and thousands of people that you've encouraged and educated and informed and supported. So thank you from me, and I know the care economy, the people that I work with, we're so appreciative of your work and for sharing more about that today. And it was really hard when we talked. I was like, oh my gosh, I want to ask her everything about everything. So I'm like, we only have an hour, and I had to really narrow it down. But someday we'll have to have you come back because I know that there's so much more that you can share and educate us on. So thank you so much.
Yes, of course. It was so fun to talk about this. And yeah, I would love to come back. There's so many more things we could talk about.
Yeah.
We're just getting started.
We are. We are. Well, thank you. And we'll direct everyone to Be Light Care. And all of that will be in our show notes and on the website, and they can know where to find you. So thank you so much.
Perfect. Thank you.
Thank you for listening today. If you enjoyed our episode, please subscribe and give us 5 stars. In all honesty, we'd love to hear from you. Thank you so much for listening to our episode.